Welcome back to my channel, baby girl. It's Carla Toledo once again, and today we're going to be talking about the dental hygiene program. All about the dental hygiene program. This is going to be like the new Game of Thrones, the new cool show that's out there right now. Whatever it is, that's going to be this YouTube channel, okay? So stay tuned for the upcoming vlogs about dental hygiene program. Unfortunately, I cannot get all that information into one video because it's gonna be like a movie, like an hour-long movie, and I don't think you guys are gonna want that. So what I'm gonna do is break it in series so you guys can watch it. So yeah, let's get right into it. So let me give you a little bit of background on my dental hygiene program. I went to Middlesex Community College in Lowell, Massachusetts. It was about an hour away from my hometown. It is an associate's degree program. You know, the dental hygiene program at my school was very competitive. The first year that I applied, I didn't get into it. I'm gonna link my video somewhere. And out of a lot of applicants, only 32 students get in this program. So it was very hard to get in. The prerequisites that they require you to take are Anatomy and Physiology 1 and 2, English 101, college level algebra, Chemistry 1 with a lab, and you need to pass it with an 83% or higher, or a B or higher. The GPA that they require is not that bad. It's 2.5 GPA. They require you to attend a dental hygiene information session prior to getting accepted to the dental hygiene program. If you have time, these are the other classes that you can take. So even though these were not prerequisites, you could take them while you're in the dental hygiene program. I highly advise you to take them prior. That way you focus more on your dental hygiene classes. But you need to take psychology, sociology, microbiology, English composition 2, chemistry 2. I think that was about it. For my dental hygiene program, the deadline is in February. So you need a completed Middlesex Community College application form. You also need to have 3 letters of recommendation. One has to be coming from a faculty member. You need to have an entrance essay, okay? And I think that's very important because we didn't have to take any other exams. So the way that they would know us a little bit better would be through our letters of recommendation as well as through our entrance essay. So I think for us, that was like the biggest thing, the essay. On my essay, I focused a lot about how I came from another country and how I want to give back to my community by volunteering. I said, you know, I work in a dental office and I really love the interaction that the hygienist has with their patients. So I did make it very personal, and I was very honest, and I was myself. I wasn't trying to be anybody else and lie. You know, I just really poured my heart out into my essay. And let me tell you, I had like 10 people proofread it. Ooh, the sun, honey, shining. Another thing that I would highly recommend you do, if you have to write an essay, make sure that a lot of people read it. Watch them reading it. If they're getting bored, most likely whoever's gonna read it is gonna get bored. If you see that they're like getting distracted, or ask them questions like, oh, what did you get from my essay? Take all their input, take all their advice, and make it better. I had to correct my essay like at least 5 times before I sent it into the dental hygiene program because I really wanted to get it. Once you're in the dental hygiene program, you do have to take a CPR course. You have to also give a lot of your medical records to the school. You have to do a query check. And again, your school is gonna walk you through everything that they need. They're not just gonna be like, figure it out. They're gonna be there to help you out. So don't worry about that. Once you're in the dental hygiene program, you do need to receive a grade C or higher to pass your classes. I'm gonna read you guys the required courses of the dental hygiene program. So these are the classes that you're gonna take, and I'm gonna break it down by semesters. So semester 1, I had to take Concepts in Dental Hygiene 1, Dental Hygiene Clinical Practice 1, Head and Neck Anatomy, Oral Anatomy, Histology and Embryology, Nutrition. Semester 2, Concepts in Dental Hygiene 2, Dental Hygiene Clinical Practice 2, Dental Radiology, Periodontology. Semester 3, Concepts in Dental Hygiene 3, Dental Hygiene Clinical Practice 3, Oral Pathology, Pharmacology, Dental Material. So semester 4, we had to take dental hygiene clinical practice 4, community health, local anesthesia, applied ethics in dental hygiene. And that was it. Just that. Now, people have asked me, was the dental hygiene program hard? Absolutely. I think chemistry and math were harder for me to comprehend. Like, I still don't understand chemistry that well. What was hard about the dental hygiene program, it wasn't the work itself, it was the amount, the load that we got. I mean, I was doing 5 classes in some semester, and it was just like every day we had homework that was due. Every week there was a quiz. So often there was like a test. Aside from the classroom work, you also have to think about clinic, like your dental patients and all these other things. So that's what was stressful. They are trying to cram 2 years of dental stuff in your mind. So yeah, it is gonna be hard, I'm not gonna lie, but is it doable? Absolutely. If I could do it, anybody could do it, okay? I'm not the brightest cookie out there, but I believe in working hard and sacrificing a lot of things to obtain what you want. So if I could do it, you can do it. The dental hygiene program is, I would say, 50% classroom and 50% hands-on. You have to worry about your classroom studies, but you also have to worry about keeping track of your clinic requirements, passing all your case exams, which you need patience for that. In my school, they do have a small clinic where they offer preventative services at a very low fee. When I was going there, I think it was like $27 for a dental cleaning. People understand that it's being done by students. It will take me about 2 days to clean somebody's teeth, okay? So they will have to come and sit for me 4 hours, and I still wouldn't be done. So they advise you to get family members and friends to come for you. I'm gonna make another video all about how I got my dental patients, because let me tell you, friends and family, they weren't really there for me, except for some family members, which I'm gonna give you guys a shout out in my other video. But moving along.
It brings me to a dark place, people.
I'm gonna start with the first semester of dental hygiene school. I think that was the hardest semester because you just don't know what to expect. Everything was pretty new to me. Yes, I did work in a dental office, but as a secretary, I didn't have that clinical background. On my first semester, you don't need to have a dental patient. We were working on a typodont, so at least that was a little bit less hectic, okay? Second semester came in and it was crazy. But even so, my first semester for me was the hardest semester. I remember getting anxiety, which before I never believed in depression or anxiety, and I apologize for being so ignorant about it. After my dental hygiene school experience, I believe in all that, okay? Whatever people tell me, I'm like, I believe you. I've been through it. I had fear of failure, and I was crying like every day at home. My husband was even gonna take me to the hospital. He was like, what is wrong with you? Like, you're gonna be okay. And I was just like, I'm not gonna pass. I'm not gonna pass my first semester because I thought it was so much information, and I had 2 tests back to back. So I was freaking out. I ended up studying for those exams, and I ended up getting like an 87 and a 93 or something crazy like that. And then after that, my anxiety, my depression went away. But just so you know, expect that at the beginning it's gonna be, like a lot of work, but it's okay. Is it doable? Absolutely. For your exams, I highly suggest that you study by yourself and with maybe another person. I wouldn't do those big study groups. I feel like those are a waste of time. So pick a person that you feel really comfortable with and study with them. That's how I got through, passing my dental hygiene exam. When you have a study partner, a friend that's gonna be there for you, that's gonna help you a lot, because remember, 2 brains are better than 1. When Liana and I used to study together, I remember going to school and then we would go eat something and then we would head to her house, and I would stay there for like 2 hours studying with her. There were things that Liana would understand that I would be like, I didn't get that. And there were things that I would teach her that she was like, oh, I didn't see it like that, or oh, where did you find that? Let me see. So I feel like you definitely need that, especially the first semester when you're starting, start bonding with somebody so that you guys can tackle the dental hygiene program together like a team. Quizlet has great content for dental hygienists. I found a lot of information, a lot of help. The exams, are they hard? Yes. From a level 1 through 10, I will give it like an 8. You know, the school doesn't want you to fail, so they're gonna prepare you for you to be able to pass. Your professors are gonna give you all the information that you need to pass those exams, whether they are in the PowerPoint, in a video lecture, in a book. You know, the information is gonna be there. You just have to put your mind and study it. I would say if you do an associate's degree program, don't work, just focus yourself on getting through those 2 years and getting your license. Let's talk about the money, cha-ching. So since my program was an associate's degree program at a community college, it was less expensive than if I would have gone to Mass College of Pharmacy or Mount Ida, which I checked their tuition. It was about $120,000 for Mass College of Pharmacy and like $60,000 for Mount Ida. Something like that. So for Middlesex Community College, the credit is 252. The dental hygiene program was 75 credits. So there you go, baby girl. 18,900 for the 2 years. Now, first semester, I did have to pay 2,500, which was not part of the tuition. It was to get my instruments, my gloves, my mask. But I don't think it was every semester. I think I did it twice. So aside from the 18,000, you know, almost like $22,000 for the whole thing, including the instrument. Now, another thing that I want you guys to keep in mind is as soon as you start dental hygiene school and you start working in clinic, they're gonna teach you guys how to wash your hands. Your socks have to be all the way up. You know, no skin can be showing. I mean, your hair cannot be just like that. It has to be really like slick back, like if a cow licked your head or something, and then like a bun. For all my queens out there that like those long nails and the gel, once you're in hygiene school, that's gonna be gone. Just like my nails right now. In the dental hygiene clinical practice 1, first semester, they just have you use the Typodon to practice. They teach you what instruments do what is 11, 12, 13, 14, all about infection control. First semester, you do learn a lot, but the good thing is you don't have to work on a real patient. In the dental hygiene program, you see everything. I saw one of my classmates that is now my coworker. She first, when we went to the summer session, she had literally just given birth and she was on the summer session with her newborn. I had one student that had like 5 kids. I was like, how is this woman doing it? She is like superwoman. We also had an older student. I think she was in her late 40s. I might be lying, but don't get discouraged if you're an older person. It is never too late to pursue your dreams and to follow your passion. So if you're passionate about dental hygiene, go for it, get it done. Now, we did start with 32 students and I believe we graduated with 28. So along the way, something happened to those other 4 students. So it just to show you that you need to be on your toes at all times. My beauty, don't be discouraged by me or any other YouTube vlogger saying the dental hygiene program is hard and is competitive and is
vicious.
Because if I could do it, anybody could do it. I'm gonna read this quote. Sometimes you will never know the value of a moment until it becomes a memory. When I was in the dental hygiene program, I wanted it to be over. I kept telling my friend Liana, oh my gosh, I want this to be done. It is so stressful. I can't wait for it to be over. And now that I look back into it, now that it's a memory, I'm like, I wish I would have enjoyed it more. I wish I would have appreciated the journey, appreciated the experience more than I did. That's one thing I'm gonna leave you guys with is appreciate every moment, value everything that you are doing now. So if you're working on getting your prerequisites done, yes, they're tough and everything, but appreciate it now, enjoy it while you're at it, learn from the experience, because soon enough you're gonna be in the program and that's gonna be another journey, and soon enough you're gonna be a dental hygienist like me. Again, we talked all about the money, we talked about the prerequisites, the classroom studies, and we'll see what happens in part 2. Because part 2 has patients in it. So yeah, gonna be crazy. Hey girl, this is it. We're gonna be closing this vlog. Where are you going? Better give it a like and subscribe to the channel because there's more craziness coming to you. Bye.
You mean bread and butterflies?
Oh, yes, of course.